My name is Matthew Phillips. I'm a board-certified neurosurgeon. I attended medical school at Yale University School of Medicine and then went on to complete my internship and my neurosurgical training and fellowship at the University of Pennsylvania. I have a direct interest in Alzheimer's disease because it's become a very prevalent pathological disease process that we see in our brain and spine center. As you know, it's now the 7th leading cause of death in America, with approximately 7 million people in America currently with the diagnosis of dementia, and expected to reach close to 40 million Americans by 2050. Not only is this a tremendous cost to the patients, their families, the caregivers, and our institutions, but the cost to taking care of these patients is in the hundreds of billions and is expected to get up to $1 trillion by 2050. Given our increasing aging population and the increasing prevalence of Alzheimer's disease, which has gone up significantly since 2010, I believe that embarking on a more aggressive and unique approach to managing this disease is essential. One could even say it's existential. The current doctrine that the pathological protein called amyloid is being produced in the neurons and is secreted from the neurons, which then causes inflammation and death to the neurons by forming both plaques and inflammation from the plaques, is being challenged by Dr. D'Andrea's work. And in short, Dr. D'Andrea's work really looks at a slightly different pathological process with respect to Alzheimer's disease and how the neurons, the cells of the brain, die. His belief is that amyloid doesn't come from the inside of the neurons, but in fact comes through the bloodstream, gets into the brain through leaky blood vessels into the brain. And once inside the brain is then transported into the neurons. A toxic level of this protein called amyloid builds up in the neurons, and then the neurons die. As more neurons die, there's more inflammation, and then the beginning of plaque formation and other processes which lead to further neuron or brain cell death. Goals of this novel treatment regimen is threefold. Number one, to reduce the leakage of the blood vessels of the brain, and what we call that interface between the blood vessels and the brain is the blood-brain barrier. And the first goal would be to decrease that leakage to prevent this amyloid, this protein, which is dangerous to the brain cells, from getting into the brain to begin with. And we found that there's a relationship between cholesterol levels and that leakage. And so with statins, which you may have heard of, which are medications given to people to reduce their cholesterol levels, there is a belief that can help reduce the leakiness, if I may say so, of the blood-brain barrier and hopefully decrease the levels of this dangerous protein amyloid from getting into the brain. The second prong of this very convincing treatment regimen would be then to block the amyloid from getting into the neurons or the cells of the brain. We know that amyloid most likely gets into the cells of the brain through something called an acetylcholine receptor, which is essentially a channel on the outside of the neuron or the brain cell, which allows the amyloid to get into the cells. And if we can block this receptor, even if amyloid gets into the brain, we can block that protein from getting into the neuron and injuring the neuron. The third prong of this treatment would be to decrease the inflammation in the brain, simply with anti-inflammatory medications. You've heard of that Motrin, naproxen, or ibuprofen, maybe even Tylenol. And with this creative three-pronged approach, with medications which are already FDA approved and already out there on the market for other pathological processes, Dr. D'Andrea fundamentally believes we could actually arrest the development of Alzheimer's disease. The thought of that is profound, to say the least. However, as you know, Dr. D'Andrea passed away too soon before he could accomplish this work. The ZN Foundation has taken up the baton, so to speak, to keep this work going and continue the search for a potential medication or group of medications, cocktail, if I may, to decrease the development of worsening Alzheimer's, or maybe even to cure it. There's some final experiments which need to get done to move to the next step of putting together a medication that can be given to people.